For those of us not blessed with a full set of lips, here is some help that's available. Lip enhancement is a simple office procedure that should leave your lips feeling soft and natural. Dr. Samuel Lamb with Lamb Facial Plastics is here this morning to help us better understand this procedure. And he even brought some props with him. Good morning, Dr. Sam. How are you?
I've got to control these props. I'm going to tell you what we're not going to be doing today. We're not talking about these kind of lips, okay, duck lips.
I mean, he's cute and all, but I don't know if I want this on
We're not talking about these kind of lips, sausage lips.
Good sausage lips. Not good.
And we're not talking about these kind of lips,
Oh,
okay?
my God.
Those are gone.
Okay, so we definitely see what does not look so natural. Right. We've seen them time and time again, especially on celebrities because they're photographed so often. Can we talk about what doesn't look right?
Let's take a look at some quickly here. What we have the first one up? You know, if you see Liz in youth, she has really nice lips, and really the problem here is that the upper lip is just too big. There's no proportion. We're going to talk more about that in a moment. We have the next one. And these are just the blowfish duck lips that we saw.
Yes,
or sausage.
And she really was a cute girl.
There's no shape to those lips.
All
we have the next one.
Okay.
And again, the same thing, just really large, unshapen lips that are not balanced.
Okay, so bigger isn't always better. There has to be some kind of balance and symmetry to the whole procedure.
This one also, if you look at her natural lip when she was young, she had a nice curved shape to the bottom lip, and the upper lip is just distorted and large.
Okay, so, and we can see this on the duck. When the upper lip is bigger than the lower lip and it's not balanced, I mean, this is just not a cute look.
No, not at all.
Except for if you're a little chicky like this. Okay, so we definitely know what's not natural. Is there ways to make sure we do get a natural enhancement?
And let's call up the first graphic here. I want to show you what a natural lip design is all about.
Okay.
This is what I call the ball design. It's not, your lips won't look like this, but it's a template for understanding this. The lower lip, there's a nice curve and taper and a cleft and a shape. And the upper lip, which should be smaller, has a nice shape to it too. The biggest mistake I see all the time when people walk through the door is that they make the upper lip done in isolation. It just looks too big. Or there's no shape. Those are the two biggest mistakes I see all the time.
Okay, so no shape and too big.
Absolutely.
Okay, well then let's talk about some options that we have when it comes to lip enhancement.
Well, the first thing I don't do is I don't like solid implants. They feel unnatural, they look unnatural, they tend to shrink. But what I like to do, there's really two major options. A temporary option for people just trying it on, and a permanent option. A temporary option would be Restylane or Juvederm, which are really nice, natural, soft materials that are going to be there just for a short time, sometimes lasting 3 to 6 months, sometimes a little bit longer. And what I really like is silicone. Now, silicone, if it's done poorly, we're going to talk about a case today, a nice lady's here with me today, but and also if it's done well, it's just seamless. You can't feel it, it's natural, it's soft, and it's permanent. But it's also, you have to build it slowly and gradually. The main thing, and anything I want to get across today is there's no pain. There is really, you don't feel needles or burning.
You do? How is that possible?
Well, it's...
Because you're magic.
Well, yeah, I use a wand.
You use a wand. So is this an in and out kind of procedure?
It really is. You come in and you leave. It's really amazing. And we're going to we'll show some results here if we have that first one. This is more of a medium lip, you can see, and it's a pretty full lip, but the thing I want you to see is that there's a shape, there's a cleft on the bottom of the lip, and there's a nice taper, and it's bigger than the top lip. This is what's so very, very important. Next one. This is a very aggressive lip, a much more dramatic lip, but at the same time it looks natural because there's a shape to the bottom lip where there's a cleft and there's a taper, and the upper lip again is smaller. And
the things that I would notice when I look at these stills, I would say you notice that they have really good lips, but I would never say that's someone who's had some work done and enhancement on her lips, and that's the whole key, right?
Absolutely, and they have to be totally soft, which is so important.
Yeah, soft is a big, and we see with poor Meg and others that maybe sometimes they don't have really soft lips at all. Well, we love your work and we love to see it in person, and you've brought a patient of yours, Ellie, along with you. Hi, Ellie. Thank you so much for joining us today. Tell us about your experience with lip enhancement.
Years ago, I had silicone, a poor job of silicone put in my lips, and Dr. Lamb so kindly repaired my lips and gave me back my smile, and I don't feel embarrassed to smile or to talk anymore. My upper lip was very large and unproportioned to the rest of my mouth. And it was so painless. I didn't have any pain. In fact, my husband didn't even know I had it done. I teach school. My students didn't know I had it done. So I think that that's a testament to his work.
Well, every time Dr. Sam's patients come on here, they are just raving about him so much, and your lips look amazing too.
Thank you.
And that's a point too. If someone's had maybe a lip enhancement done that they're not fully satisfied with, there is things that can be done.
Can we pull that graphic up just for one more second? I just want to show what we've done. The upper lip is just too big and there's no proportion to it, so I trimmed down the outer portions and made it much more proportional to the lower lip, and I augmented the lower lip, and now you can see that beautiful shape.
That looks amazing. What a great result. And nothing is more important than your smile and that self-confidence you feel about having a good presentation, especially on your mouth, right?
Absolutely.
All right, Ellie, thank you so much for being here with us. Dr. Samuel Lamb,
Thanks,
thank you
Amy.
so much for your enhancement. We don't want to look like this, people.
No.
Not a cute look.
Or this one.
All right, especially that one. If you would like to learn more about lip enhancement, log on to lambfacialplastics.com. You can also call 972-312-8188 for more information.